Hi. So next I'm going to be going over phase 2 of swallowing, which is also known as the oral transit phase. So I'm using a different patient than I previously did. So this is Jack, and he's 72 and he recently had a mild stroke. So what we're kind of observing is during lunch times when Jack is eating applesauce, the food is staying in his mouth, but he's struggling with moving his applesauce to the back of his mouth. He often has to take multiple swallows to get ready to send that food down his throat. And then sometimes the food will get stuck along the sides of his tongue or to the roof of his mouth. So basically what's going on here is Jack's having a really difficult time with moving his food from the front of his mouth to the back of his mouth. So this is, again, the oral transit phase, and this is when it's slowed or uncoordinated. And although the bolus formation might be okay, that propulsion to the back of the throat to swallow our food is what's impaired. So during this time, we're really focusing on structures such as the tongue, the hard palate, the lips and cheek, and the soft palate. Honestly, we're really just looking at the hard palate to focus on, that tongue that presses against the bolus, like the tongue pressing the bolus against it. But again, so we're going to look starting with the tongue. This is what moves our bolus to the back of our throat and kind of shapes it to get it ready to again send it down our throat. So the muscles that we're going to be using in this is the genoglossus and the styloglossus, as well as the intrinsic muscles. And this all involves cranial nerve 12, which is our hypoglossal cranial nerve. And then next, we're going to focus on the soft palate, which is our levator veli palatini. And this just kind of begins to elevate to get us ready for that swallow prep. So pushing it against. And this includes cranial nerve 10, which is going to be our vagus nerve. And then again, we're going to use those lips and cheeks. So the orbiculus oris and the buccinator to keep that bolus in the center of our mouth. And this is going to include cranial nerve 7, which is our facial nerve. So again, the tongue is just pushing that bolus backwards. The lips and cheek are just kind of stabilizing that bolus as it moves. And then the soft palate is what helps us slightly prepare for our next phase, which I'll talk about in the next video, which is the pharyngeal phase. So some consequences of this phase is the food is moving much slowly, or again, it's getting stuck to the roof of our mouth or the sides of our tongue, so it's moving unevenly towards our throat. And this, again, requires those extra swallows to prep for it. And this, again, just kind of has the increased risk for choking or aspiration since we already have that spillage happening. And again, just like Maria, this might make meal times for Jack a little bit longer and a little bit more tiring. So basically, in conclusion, that is the oral transit phase. Your tongue is just moving the already chewed and formed food from the front of your mouth to the back, prepping it. So when the muscles or nerves don't work correctly and the food gets stuck in the mouth or spilled towards the throat too early, this is what increases his risk of choking and can make it less safe to eat. Thank you.